thought, an idea produced by or occurring suddenly in the mind. Perspective, a particular way of considering something, a point of view. He has no idea what he's doing, but he's giving it his all. It's him. It's really him. Your host, Matt Logan.
Marie Curie said, "Nothing in life is to be feared. It is only to be understood." We need to take the time to understand more so that we can fear less. And I'm not saying that verbatim, but I have Dr. Senator Scott Jensen here today. Thanks for being here.
Thank you, Matt. And Cervantes 500 years ago said, "Make it thy business to know thyself."
Yes.
And that's a challenge. And I think these days we're having the opportunity to learn more about ourselves. And sometimes I think we're learning things we may not want to learn about ourselves.
Are we learning about ourselves, though, man? Because I think when you learn about yourself, you take the time to reflect, right? You self-reflect. Oh. And I don't see a lot of that. Communication right now doesn't exist. There's no dialogue or discourse. It's either this way or that way. And it almost doesn't matter like what your viewpoint is.
That's a good point. Socrates said the unexamined life is not worth living.
Yes.
And I think maybe that would be more spot on, because I think that what Socrates was saying is if you're not willing to examine your life, then really you're living a life that's far less valuable than it could be. And you're right. We need to be hitting the pause button and asking ourselves, why is it that this person who I previously held in reasonably high regard sees things so differently than I do? It seems like now we go straight to contempt. We hold them in contempt. They're a knucklehead.
Yeah.
Instead of saying, help me understand why you see it that way. I mean, it's across the board. We have probably 5 different topic areas within the concept or the overarching umbrella of COVID-19. We probably have 5 easy areas where we could talk about that in terms of, school closings, masks, vaccines, medications, government agencies, what their role is, lockdowns. And this is just within a few months.
Yeah, a few months.
Yeah.
That's crazy.
Yeah.
I mean, World War II, we didn't have this kind of lockdown. We didn't have situations where governors or presidents were basically saying that we're not going to vote on things and do this and that, and legislative issues that our Constitution clearly states. Yeah. I've been following you for a couple months because you pushed back. You didn't go along with the narrative, and you didn't push back simply because it was something that seemed like the trendy thing to do. I'm not trendy. You're sitting down with me. That says a lot about your integrity. It says a lot about your character. That means you care about people. And discourse. I've reached out to a lot of different people on all sides of issues, and really, to be honest with you, Republicans are the only ones, whether they're in office or not, are the only ones that will actually communicate with me. A lot of them won't even return. Actually, there hasn't been one Democrat. And I don't want to make it about politics. I really don't. But when you said that, that popped into my head. Like, why? Why is that? Do they not want to reflect? Do they not? You're in politics. I mean, is that something that you've seen more now than ever before when you started, I think, 2015 or 16?
Well, I have seen it, I guess, up front and close, and it's disappointing. When I decided to run in 2015, I made it clear to the constituents and to the people that donated and supported my campaign. I said, I am not running to go down and rub elbows with muckety-mucks. I'm not going down there to find a new career because, quite frankly, being a family doc is just, as far as I'm concerned, the best job in the world.
Yeah.
And so I went down there assuming that I would have challenging conversations, but those conversations would be what I considered crucial.
Yes.
And so I had them, and I got in hot water in the first year. I said, we should be able to provide some basic package of health care for every Minnesotan just on the rights of being a human being. In other words, I don't want people dying of pneumonia on the streets because they didn't have health insurance. I didn't want someone's appendix rupturing because they were frightened that if they went to the hospital, they'd get a bill that was so big they'd have to take out a second mortgage on their house. Now, I didn't have the answer as to how to do it, But I knew that it was something we should strive for. And if in striving for it, we had to pick and choose some pieces from each party and go both sides of the aisle to find the answer, then by George, that's what we had to do. And that was problematic for some of the people on my side of the aisle. Then a year later, I remember what I thought a crucial conversation would be was, how do we try to do a better job of identifying that very small group of people that are prohibited from owning guns and should be prohibited based on previous involuntary commitment to mental health hospitals and things like that. And I said, we have to have this conversation. And again, it blew up on me. And people said, Doc, what are you doing? So then last year...
They're probably saying like, hey, I thought you were a Republican.
They did say that. I mean, oh, yeah.
But that's just it. That's what you're saying. Both sides of the aisle, you need to communicate. You need to come up with solutions.
Yeah, and I remember working after that. I mean, I remember the hot water I was in, and I remember there was an NRA guy named Brian Gosch. And he and I had a couple of conversations, and he was in politics in South Dakota. And I think he was possibly Speaker of the House. And he and I worked together to try to come up with a bill that didn't go against the Second Amendment, but also would potentially provide a better chance of stopping prohibited people from getting guns, strengthening the straw man purchasing law so that we're not doing that. And we worked together and found some common ground. And by the time that session was over, I had Republican colleagues looking at this bill and saying, I could live with that. And that was really fun. Then the next year, I think, I was asked if I would run with the pharmacy benefit manager bill. And I don't know if you're familiar with pharmacy benefit managers, but it's basically a PBM. It's a middleman. Mm-hmm. The problem is they really distort the marketplace. And in so doing, prices are crazy. There's a lot of gag clauses where pharmacists can't share honest information with their patients at the counter. And so we passed a nation-leading bill on PBMs. And so that was fun last year. And so I thought this year, because I announced I wasn't going to run for re-election, I thought it would be a little bit of a lower key year. And then all of a sudden, I think we're in the second day of the session, and I was asked by the Senate Majority Leader if I'd take on the insulin bill, because the insulin bill wasn't moving. And he said, Doc, if anybody's going to get this bill passed, it's probably you. And so I dug in, rolled up my sleeves, started working with the Democratic House, and we got it done. And that was fun. And I thought, well, that's more than I thought we'd get out of this session. And then COVID-19 hit. Mm-hmm. And with COVID-19, I have to confess, I am a skeptic. I'm skeptical of a lot. I was raised that way. My dad, we'd sit at the dinner table and we'd talk about Vietnam. We'd talk about vouchers in public education. My dad was a lawyer, a politician for a period of time, and then a judge. And we'd go around on anything. And if you didn't have something intelligent to contribute, you were expected to be quiet and learn until you could make a contribution that was halfway intelligent. So I've been a skeptic. And
when you say skeptic, clarify that, because do you mean you think it doesn't exist, or it's man-made, or that explain the skeptic piece?
I guess I have a hard time accepting someone's viewpoint or narrative lock, stock, and barrel just because they said it. Yeah. Sometimes I think people will say something in a pretty commanding way, and they expect everybody in the room to buy into it. Yeah. And I'm usually the guy that says, well, hold it. I don't quite get that. And that's really what happened on April 3rd, a Friday, when I received a communication from the Minnesota Department of Health regarding how to complete death certificates. Mm-hmm. I was flying along, seeing patients running behind, and I was trying to do emails, and I saw this email. I was about to delete it because I get a lot of emails, and this one looked like another boring email. And then I saw it said Department of Health, and it said something about vital statistics. And so I clicked on it, and I'm reading it real quickly, and as I got to the bottom of this communication, I could just tell my brain was pinging. Yeah. And I thought, what the devil, this isn't right. And I read it 2 or 3 times, and basically said that if you were going to be completing a death certificate on a patient regarding COVID-19, the rules were changing. And I was being coached to go ahead and put down COVID-19 as the cause of death, even if I hadn't tested for it, even if I hadn't thought about testing for it. If I could assume that COVID-19 was the cause, or that it was a contributing cause, I could put it down as a cause of death, the cause of death. And traditionally, over the last 35, 40 years, when I've done death certificates, this is always an exercise, if you will, in sort of a precision-based sequence of causation. In other words, if someone died, what initiated the process?
Yeah.
Not the last thing. I mean, the last thing is always, if you will, in a cause of death, the heart stopped. Well, you can't put cardiac arrest for every death certificate.
Right.
You're supposed to go back to the initiating cause. So if someone's got congestive heart failure, maybe it all started with a heart attack when they were 55. And then by the time they were 65, they had congestive heart failure. And by the time they were 70, they were having increasing shortness of breath. And it got so bad that we knew they were going to die from it. And the patient didn't want to have aggressive treatment. So the patient asked, could I go on hospice? So that we can sort of pivot away from the typical Western medicine, aggressive, keep doing tests and all that. So we put them on hospice, and maybe in the third month of hospice, they're doing poorly. They develop a fever, a cough, and I go up and examine them, and yeah, they've got pneumonia. And so now they've got congestive heart failure from an initial heart attack, and now they've developed pneumonia. And the family's gathered around, and they've said their goodbyes, and all of a sudden we find out one of two things. One is a routine laboratory test for some reason or another was done, and it shows COVID-19. Or a laboratory test wasn't done, but other people that were exposed to the patient while he was on hospice were found to have COVID-19. In either of those situations, we were being encouraged to put down as a cause of death COVID-19. And that's all wrong. The cause of death was, you could go one of two things. You could say congestive heart failure, but actually if you do the initiating event that caused the heart muscle to get floppy and weak, you could put down heart attack. And that's the bottom line. And that's the underlying cause of death. And that's the all critical one. And then above that, the heart attack caused the congestive heart failure, which led to the pneumonia. And then you had this COVID-19. And you could say, well, that had nothing to do with it. Or you could put it as the last thing that happened. That would be okay. Or you could put it in part two, which is a contributing condition, which is typically where we'd put something like that. I might put diabetes because that would be a contributing condition. It wasn't in the direct sequence of causation, but it probably contributed to the patient's overall weakness. So you'd put it there. But that's what happened on April 3rd. And I saw that and I said, nuts to this. This isn't right. This isn't the way I've done things.
So a commoner, I don't mean to interrupt you,
Sure.
but a commoner like myself, a guy down in the trenches, you're in a different type of trench than I am, but someone reached out to me. My daughter died in a car crash, you know that. And so I speak with a lot of people and just try to, help them through a little bit one-on-one. Someone reached out to me and said, a friend of theirs had died in a car crash and asked me to reach out to the family. I reached out to the family, and the family then returned my message about a week later, week and a half. And they said, they kind of went through what the process was, and they said, but they listed COVID as the cause of death. And that's where I started to be like, is what? A car crash, but on their death certificate was COVID. Well, that's an accident. That's someone that mixed something up. No way. So they hire an attorney, blah, blah, blah. They're still in the middle of it. But then, unfortunately, a suicide in, I believe it was very early May. Same thing. COVID-19 caused a death. What?
And this is where I sort of started getting in hot water, because a couple days later, I was on a TV show out of Fargo, Moorhead, being interviewed by a news person named Chris Berg. And he was asking me about a commentary that I had been a co-author on that had been published in the Minneapolis Star-Tribune a week earlier. And while he was talking about that, then he asked about the modeling that the governor was using. And I made the comment that I don't think that Minnesotans want things sugar-coated. We want it straight up, and we want the real truth. And then I said, for instance, I don't really think Minnesotans are interested in having death certificates casually using COVID-19 as a cause of death if we hadn't done a test or hadn't been interested in doing a test. And Chris stopped me and said, hold it, say that again, Dr. Jensen. I think I maybe misheard you. So I said it again, and honestly, Matt, that was the pivot point right now, Tuesday night, April 7th. And it went wild. I think that 6-minute news program was seen by 5 to 10 million people. And I was then asked to be on Fox News with Laura Ingraham a couple nights later. And she said, tell us about that. And so I just talked about the Department of Health Communication and how it linked to a 7-page CDC document of instruction. And the whole thing just sort of went from there. I did my homework. I mean, I checked with more than 100 physicians. I went on the CDC webpage and reread the manual for physicians as to how to complete death certificates. And this was totally flying in the face of what we've been doing for years and years and years. And we've never done that with influenza. I never got any kind of communication like that when we had SARS or MERS. So this was a new thing. But I think it was sort of born of my typical sort of skepticism. I read this communication from the Department of Health. I said, nuts to that. That's not right. And so I mentioned it sort of offhandedly in a news program, and it became, if you will, a moment or an instance where all of a sudden I had unwittingly become this gigantic whistleblower. And ultimately now I've been called out by, I think, some political activists for spreading misinformation. But this is not misinformation.
And so you don't know who that is?
I don't get to face my accuser. Not with the Board of Medical Practice.
And see, that doesn't make any sense to me.
Well, it maybe does.
Sure.
Because
so help me understand.
The Board of Medical Practice has important work to do. They're charged with protecting the patient.
Yes.
And quite honestly, physicians screw up. You know, how many times have we seen or heard that story about a physician inappropriately crossing some sexual boundaries with a patient, or started to self-prescribe, or perhaps started to help him or herself to some opiate samples or to some benzodiazepines like Valium samples. So the Board of Medical Practice does have some important work to do. If you look at the legal legislative statute, they're charged with a pretty broad set of standards that they look into. And this is what's happened. They're basically being forced to look at these 2 complaints against me, 2 allegations. One, that by being on that news program on April 7th, I spread misinformation. And 2 was a very nebulous allegation that said that by being willing to compare COVID-19 to influenza outbreaks, I was guilty of providing reckless advice. So those are the 2. 2 different people, don't know who they are, seems politically motivated. I got the impression that it had nothing to do with patient care because in the letter from the Board of Medical Practice, it says public comments. And where I was surprised was, I guess I thought as an elected official, as a senator, there might be some latitude because I have to make public comments. Shoot a mile. I'm the vice chair of the Health and Human Services Committee. Yeah. I've carried the 2 biggest pieces of policy, healthcare legislation in the last 2 years in terms of PBMs and insulin. Of course I'm making public comments. But I understand the Board of Medical Practice has to do their due diligence, so they will, and I'm going to cooperate, but yeah, it really feels ugly. And as a professional who really loves being a doctor and who's been named by the Family Practice Academy Doctor of the Year a few years ago, this stings pretty deep.
Yeah. I'm glad you're pushing back against the narrative, though, because I think so many people, especially in your position, you're not up for re-election. You're not going to run again, things like that. You could have faded into the background, so to speak, but it circles back to your integrity and character. That's just not you.
Well, and it's also not why I ran. I didn't run for office so I could run away from crucial conversations. I got in hot water about a year ago because all of a sudden I was this lightning rod regarding the marijuana discussion. And I was looking at data that showed that if you have something like, I think it's 42 grams of marijuana or less, it's a petty misdemeanor. If you have more than 46 grams, it's a felony for which you can go to prison and be incarcerated. That seemed like a huge difference for 4 grams. But what really disturbed me was that if you were found with just a trivial amount more than 42 grams, the number of those people that were white or black was such and such. But if you were black, the chances that the full force of the law would come down on you and you might be incarcerated were way higher. And I said, well, this is wrong.
Yeah, that's right. That's
So
bad.
I said, let's talk about decriminalizing it and let's make it more sensible. And I think Mike Freeman, the Hennepin County attorney, said the same thing. And I thought, I think he's right. And then I also said, and for that 18 to 21-year-old kid who makes a dumb move or mistake and has this trivial amount and wasn't selling it and was just experimenting, do we really need to have it on their record for the next 10 years? So I just wanted to talk about those things. And that got me in hot water. I don't support recreationally legalizing marijuana. If we're going to do that, I think the whole state of Minnesota should decide that. I don't know why you'd have 200 people decide it.
Yeah.
But that's another day down the road.
Yeah.
But I just think that this is what's wrong with politics today. We're so darn concerned about winning our next election and potentially offending voters or donors. Those are the two things, donors and voters, that we avoid the crucial conversations. And we're doing the same thing now with COVID-19. I would say that on COVID-19, I'm sick and tired of talking about masks. Because this decision is not going to be based on science. This decision is going to be based on emotion.
Let me tell you what, I spent 20 years in the woodworking business, okay? And so we dealt with chemicals. I just had a small shop, about 7 to 10 people employed at a time. So masks for us, right? You had to wear the big old respirator if you're staining or doing lacquer or things like that, and you cannot smell anything. But what the material safety data sheets say is don't wear them for more than 2 hours or whatever. I'm going off of memory, so someone can check that on. But and then an N95 mask, you can use that for like sanding dust and some of those types of things, and that's going to do a pretty good job. But on those material safety data sheets, they would talk about the cloth masks or things like that. And that's not going to do any good, even with dust. Mm-hmm. Why all of a sudden is that science, air quotes, thrown out the window when there's a seemingly political agenda? And look, I spent 20 years in dealing with masks. I know that they don't work for viruses. It said it in all the material safety data sheets that we had. Viruses are way too small.
Well, I think you were operating off of data that had been generated by a relatively nonpartisan perspective. This was science. And that's what we taught in medical school for the last several decades. And now what we're talking about is flying in the face of what we've been teaching medical students and residents and interns for the last 20 years. And we're doing it in flying in the face of some good data from European investigators. There's a Dr. Streeck over in Germany who's done some specific work on this, but it doesn't seem to matter. I think what's happened is we're just so overwrought with wanting to do something, anything, whatever, to the point where it has become literally politicized.
And it's a psychological thing.
I think it is. And so, I wear masks if people want to wear masks. We recommend them in our clinic. We do everything we can to encourage it, but there's a lot of folks who don't do well. I've had patients pass out from wearing masks. Yeah. I've had patients, when they wear masks and try to go up a flight of stairs, their blood pressure goes up, their heart rate goes up, their oxygen saturation drops, and they feel sick. But
wait, honestly, you're a medical professional and you're saying that?
Yeah,
it's all over Facebook that's not true.
Well, here's the case. If you don't think it's true, if you don't think breathing in a mask, particularly an N95 mask, makes a difference, then ask yourself if you've ever seen someone having a panic attack. Because when they have a panic attack, they feel very desperate. They feel nauseated. They feel like the world's closing in around them. Oftentimes they're having tingling and numbness in their feet, in their hands, and oftentimes they will actually faint. So what do we do with a person like that? We grab a paper bag and we have them breathe into it. Why are we doing that? Because we want them to breathe air that has an increased amount of carbon dioxide so that we can normalize their pH in their blood. Yeah. In other words, when you're breathing something other than fresh air, you do change chemistry and pH in your blood and in your bloodstream. So don't kid yourself. And just because you're 45 years old and healthy as anyone, that doesn't mean that the 65 or 70-year-old person is going to tolerate the mask to the same level you will. It really doesn't.
Yeah. Let me ask you this. So all over Facebook and Instagram and everywhere else, there's this scientist that put a mask on and coughed into a Petri dish, and there's hardly any growth on it. Coughed into one without a mask, and there's all this growth on it. Back to you.
I've seen that study. I actually read the article, and I think in that article there was another part where they tried to harvest viral particles from the mask. And what they found, but what isn't being highlighted when that research is being discussed, is that there was more viral particles harvested from the outside of the mask than the inside, indicating that more virus was getting out than being kept inside. Yeah. But again, what's happening is we're using our own biased set of lenses to interpret that.
Confirmation bias.
Yeah, it is. It's a groupthink kind of thing.
Absolutely.
And so in that situation, I saw that article, and I saw another one where they were blowing out a candle. But to me, when I did my analysis and I looked at the size of the pore, or how much you could filter, the cotton and surgical masks can reasonably be expected to filter out 5 micron particles or more. And a lot of people say, well, what does that mean? Well, the smallest thing a human can usually see with the naked eye is maybe a speck of dust floating in the sunlight when it comes through the window, and that's about 50 microns. The diameter of a hair is about 100 microns. So we're talking now 5 microns, which is about the size of a red blood cell or a larger bacteria or a large particle. That's what we can filter with a surgical or a cotton mask. But the problem is the COVID-19 particle, if it stands alone and isn't a part of a large particle, is about 0.1 micron, which is 50 times smaller than a 5 micron large particle. Well, what does that mean? Well, if you wanted a comparison, if you look at the space between a chain link fence, that's 2 inches, which is 51 millimeters. And a gnat is 1 millimeter. So that means that 51 gnats could fly through that chain link fence at once without any of them hitting the actual wire strand. And that's exactly what 51 COVID-19 particles could go flying through that pore size at the same time, conceivably. So that's why it just doesn't make a lot of physical sense. But I can certainly understand where you'll have some inadvertent collision on the lattice work. And in that
That's
situation,
a really good way to put it, inadvertent collision.
Yeah, but I think in that situation, you may drop the viral load that's being potentially transmitted outwards, I don't know, 25%, 50%.
Yeah.
But then the question is, does it matter?
Yeah.
And I think we've been working under science, and that science has been based on influenza viral particles for the last 20 years. And that's why Dr. Mike Osterholm and other experts in the field have said, no, it makes no difference. I mean, Mike Osterholm just did a very nice video on June 12th, which is a month ago, coming out saying masks aren't going to help you, but if you want to wear one, go ahead.
It makes you feel good if it's an emotional support.
The danger is that we lull people into thinking that they've got adequate coverage. Yeah. Frankly, if you're one of the vulnerable group, if you're going out wearing a mask and you think you're protected, you're kidding yourself. We need you to be quarantined. Or if you're going to go out, we need to have stores maybe preserving a portion of their store hours for people that are particularly vulnerable, so that you know that it's not just going to be 6-foot distancing, it's going to be really spread out. And for the first hour or two of the morning or something, people that are really vulnerable can come in and purchase their products. And we need to be creative and do things like that.
We're in your surgery room.
Yeah.
That's surgical. That's why is it the blanket effect? I mean, you're probably going there, but being in your surgery room kind of reminded me that makes total sense. That's reasonable and logical.
I think people sometimes think that surgeons, when I'm doing surgery, that I wear a surgical mask in order to provide absolute sterility of the surgical field, and that's not the case. If you actually go back 100 to 120 years ago, Taylor Caldwell wrote a good book called Testimony of Two Men, all about the birth of antisepsis and aseptic environments. But we wear surgical masks for a couple of reasons. One is if during our surgery we cough, hiccup, burp, or whatever, and potentially have large particles, they're not going to spray onto our surgical field. So if we did have large particles, staph or streptococcal bacteria on it, we would protect that. But a big part of it, too, was to protect us from fluid splashers blood sometimes all of a sudden. I mean, I can't tell you how many times I've been doing surgery where all of a sudden, boom, I've got a pumper, and I've got blood splashing all over. My shirt's ruined for the day. My lab coat's got to go. But fortunately, I either a surgical mask on or hopefully I kept my mouth shut. There are many times I've had to step out of surgery and go wash my eyes out and because something got in there. In the emergency room, you have someone all of a sudden, you revive them, and the first thing they do is throw up in your face.
Yeah.
It's a good idea to put a surgical mask on and wear glasses or goggles. So I think sometimes people had the wrong impression. They thought surgical masks did more than they do, and so they thought, well, I'll have a cotton mask. But I really do think that we're going to have the decision made on masks based on something other than raw science. I think that if we wanted the best science, I would go back the last 10 years. Look at science that was done without, if you will, a preconceived notion. Because right now, doctors and scientists do get caught up in this whole political discussion. And, I think we used to be better at staying above the fray. And that's why I'm skeptical even of the CDC. I think the CDC has become more of a political monster than it used to be. If you look back to the 1940s, the CDC was created to help us defend humans against malaria. That was its original mission. But through mission creep and through the years and through political excursions, we have seen the CDC spend billions of dollars on things that have nothing to do with pandemics, epidemics, malaria. They'll spend it on accidents in the home. Do people feel mentally healthy in home? Do they feel safe? How many bicycle accidents are we having? What can we do here? And so with that, their budget's grown, their political prowess has grown, and if you look at what they've done this time around with the COVID-19, they messed up in a pretty big way on the testing. They didn't acknowledge their error. They didn't reach out to a country like Germany that had much better testing capabilities than we did. They kept trying to do it themselves. And then later on, they end up commingling their testing so that if they were testing a PCR test for an acute illness versus convalescent serum, looking for someone looking sort of in the rearview mirror to see if they've had it in the past. They put them together and said, these are the tests we've gotten done. Wow, the two tests are vastly different, telling us different things.
Well, didn't the CDC have to go into something into private sector to get the test done?
Ultimately, yes.
Yeah.
Ultimately, yes. But if they would have done that right away, we might have been able to get the jump on it a little bit more.
Yeah.
Now, quite honestly, I don't think contact tracing can do the job for us. This disease is so widespread, and there's so much we still don't know. And when you're talking about quarantining of 14 days and the number of people that can be sort of drawn into that loop, and now we're having places where they're talking about cases, and there are cases being counted where the patient case hasn't had a positive test. They're saying,
Really?
well, this was a close contact. And so of someone who'd had a positive test. Now, this is just starting to emerge, but this is problematic as well. If we're going to start saying new cases could include someone that doesn't have a positive laboratory confirmed test, now we're doing the same mistake we've been making the last 5 months. So, and I mentioned this back in April when I said I think I said to Laura Ingraham, I might have said it to several other people, I might have said it to Tony Robbins when I was on his show.
Yeah.
I said, we are fracturing the public trust. And we are. And you might think that's a trivial thing. You might think, well, the public will get over it. I'll tell you, if you're going to make all of our efforts optimally successful and optimally efficacious, we need to have the American people on our side. We need to have their trust that they believe that what they're being told is fact-worthy. And you know what? It isn't. We are telling them whatever we're all going to this confirmation bias place, and we're pulling data and say, this is the study that matters. No, it's this study. And you know what? Americans are no idiots. They're getting it. They know exactly what's going on. And that's why when I did a video a couple weeks ago to announce that the Board of Medical Practice was investigating me, I wanted that discussion, that engagement to be a public one, a transparent one, because I don't want this to be some cloak and dagger hidden behind closed doors. And 21
Nor should it be.
No, 21 million people reached out or were reached, and then they said, holy cow, we can't believe this is happening. And I would say to you, I'd say, listen, if it can happen to me, it can happen to you. Anybody that's got a license or a certificate from some sort of an agency whereby they could control whether or not you get to keep your good license or your good permission to do whatever it is that you do. And someone submits a complaint, and all of a sudden, you're now under the magnifying glass. And that's the way I feel. I mean, 35 years getting the high honor of being the family practice doctor of the year in 2016. And all of a sudden, I'm being called before the Board of Medical Practice because of reckless advice and spreading misinformation. My stars. I mean, when I saw the letter from the Board of Medical Practice stamped with a red confidential across it, it cut deep. It did. Took me
talk about blood pressure going on.
It took me a couple of days and took my family to help talk me off the cliff.
Yeah. So I speak to a lot of primarily high schoolers, and so the way I talk about it and think about it with my daughter's accident or crash, trust versus force. So I want to go in there and I want those students to trust me. That's my number one goal. When I first get on stage, I want them to trust who I am. I'm a regular guy. I'm a dad. Went through a horrible thing. Now here's what I learned through it. Now if I go out there and say, here's what you're going to learn, and here's what you're going to do, and here's what I think, and all those things, I'm trying to force that on them. Rather than at the end of my presentation, I tell them, look, the decision is yours. It's up to you. I am trusting that you're going to make the right decision because I just went through an hour process of educating you, and now we trust each other.
You weren't able to accomplish that in 2 minutes, were you?
Absolutely not.
Yeah, I was just thinking about a patient that I'm dealing with who's got metastatic cancer. And it is so easy for a patient like that to feel like they're just being forced into something, being literally bullied into it. This is what you got. This is what we're going to do. We'll see you tomorrow. We'll do this. Instead of saying, this is a situation and we got some options. If I were in your shoes, I'd be thinking about this. But if you'd like to, we can step back too and take the time to get a second opinion, because that might help you get to a point of comfort. Mm-hmm. And that's what you're doing. And I don't know where we got so lost. Yeah. I don't know how we thought that people can be bullied into mentally being in the place we want them. I mean, that is groupthink. In 1978, we saw it in spades with Jimmy Jones in Guyana, where he talked 1,000 people into drinking cyanide-laced Kool-Aid. And we saw it in the same thing with the Challenger when the Challenger spacecraft blew up. And we know that within the preceding few days, there had been this big argument as to whether or not the launch should take place because the O-ring had never been tested in temperatures that cold. And they just say, well, through a groupthink process, they end up coming to consensus. Everybody bought into it. They sent it up and everybody died. And the fact of the matter was there were some very, very smart people that said, I don't think we should be doing this.
Yeah.
And so you're going in front of people, sharing a tragedy.
And I'm not a very smart person.
Well, I think you are.
But
see, that's the problem right there, is I think we're all pretty smart. But I also think we can all have tremendous capacity to be pretty stupid. And
yes,
I think if
absolutely.
we tell people that, if we tell them, you are empowered to be smart or stupid, pick your poison.
Yeah.
What do you want to do?
Yeah.
Because I think if you want to be smart, then you have to engage. You have to take it upon yourself to feel good about yourself, do reading, and don't just accept things. I think being skeptical is a great step first to being. You can be skeptical and stupid too, be sure. But if you're skeptical to the point where it prods you to learn something more, I think that's when it starts to work in our favor.
Benjamin Franklin said something, and I'm not going to get it right, but he basically said that, show me how to do it and then I'll learn, right? And so that's what I think that we're missing, where I want to go in and I want to show people what happened, walk through the steps. Now here's what you can do, here's what I think, but empower them to make those decisions. Show them, and then they'll learn. I work with law enforcement on a lot of these projects, of course, and it's no offense to them. They're very good-hearted people, but they have a completely different approach, generally speaking, than what I do. Law enforcement, force, there's the word force. Mm-hmm. And so they come in and they go at it from a different angle than what I do. And they're kind of pushing this to happen rather than come this way and let's take a look at it together, right? So I get students, dozens of students in each assembly reach out and say, hey, we had Leos come in and we heard about this and we kind of, okay, it's bad, but you know what? We were on our phone, or we were this or we were that. And they said, we get it. We get it. We understand now. Thank you. And there's so much power in that when you can go in and just say, hey, I'm going to go this way, and here's why I'm going this way. And those of you who want to come along, that's great. Those of you who don't, that's up to you. And what I see in our state is, our governor, is he having dialogue? Because I don't see it. He's made a decision, and that's what he's going to do. There's people in my group, my circle, that do not. I'm going to make them really mad today when we talked about the mask and some of those things. That's just a reality, and I'm okay with that because that's my experience. That's my perspective. When we are in our own circle of like-minded people, we're never going to learn. We're never going to understand each other. How do we get out of that right now in Minnesota? I mean, I've traveled all over the country every week since this has happened. All over the country. I mean, literally almost every single state. People are scared. People don't understand why Minnesota is in the spotlight like they are. But we're in the spotlight. People are watching. And frankly, most people think that we've kind of lost our mind.
Yeah, we're in the spotlight, certainly because of, racial injustice issues and things like that. But we've also been...
Which goes back, I mean, that particular thing goes way back to 2006.
But we're also in the spotlight in terms of being almost nation leading in terms of the percentage of our COVID-19 deaths being in long-term care facilities.
Yeah.
So getting back to your point, how does that happen? I don't want to try to conjecture what Governor Walz's typical day is like, but I do think that politicians, we're particularly susceptible to groupthink because we like approval, we like affirmation, and I think
everybody does.
I think so, and I think politicians become even more so. That I think that. Well, I sit on several boards, and oftentimes one of the first things we do when we see something we're not comfortable with or wondering if we could do better is we will audit it or get someone to come in and specifically not be a part of that echo chamber within which we may be living. And they come in and they say, this presumption you're making doesn't work. What you're doing here, here, and here is excellent operational detail, but over here is the linchpin. This is why you're failing. I think that Governor Walz potentially could benefit from the same thing. Have someone come in that doesn't give a hoot if Governor Walz likes him, but will give that just brutally honest assessment. I think that's the way, because, I mean, we've got a big decision coming from Governor Walz's office on July 27th or whenever, or whereabouts, in terms of closing schools. Yeah. And you can make all kinds of cases for it. But
do you have a little more time to talk about schools or no? It's
sure. Let's take 5 minutes because it's critical. Yeah. This is going to be one of the most legacy remembered decisions from this COVID-19 of any of them.
Yeah.
I mean, we will talk a year or two down the road about long-term care facility death rate. We will talk about lockdowns. We will talk about masks. We will talk about, was science able to hold its own in the face of powerful emotionalism? But we will talk about school closures. And we will look at other countries. And each country, each state will be looked at as its own little laboratory experiment. I don't know why in Minnesota we think that we need to have one size fits all. We have school districts in counties that are incredibly different than school districts in Hennepin. We have 87
counties. I've been to them. They're very different.
Yes. Some of them, I think we have counties that still have no COVID-19 deaths. I think every county in Minnesota now has at least one COVID-19 case. But we have counties where suicide and motor vehicle accidents are incredibly more important to that county and to those kids than COVID-19. Yeah. And yet, with one fell swoop, we're going to tell counties that have crappy broadband access that when they flip up their laptop and want to click onto a page to see how to answer this question or learn about who George Washington was, it takes 45 seconds for one screen, and then all of a sudden it blinks out. I mean, folks, we have 87 counties, and there's only a handful of them that are, if you will, metropolitan counties with the kind of internet access that people would want. So to me, we need to make sure that groupthink is not driving this school closure decision.
Yeah.
And there is very good data that we can let kids go back to school. And I think another thing, again, getting back to that skepticism, Matt, if you're skeptical about something, and you find that someone else is skeptical about it, and you normally don't agree with that person or that organization, now you're starting to cook with real gas.
Yes.
I mean, I normally don't agree with everything the American Academy of Pediatrics has to say. They have a different perspective. I'm not saying who's right or wrong. I don't know if anybody is. But when all of a sudden I find myself on the same side as the American Academy of Pediatrics, I say, whoa, they may look at this school issue from a different perspective than I do. But I know that I've talked with many mental health therapists, and we talk about adverse childhood experiences. They're called ACEs. And the more ACEs a kid has, the more likely they're going to have problems down the road. This, my friends, is a huge ACE. When all of a sudden you don't get to go to school, you don't get to have play dates, you don't get to see your friends, you don't get to learn formally. You're told, learn through distance learning, and if you're not successful at this, then you must be a dummy. Mm-hmm. We are hurting kids in so many ways. This is really nothing more than one huge, gigantic social experiment. And you know what the subjects of our experiment are? Our kids.
Yes.
And you know when we're going to see the consequences? Years down the road. Mm-hmm. And you know what? The politicians who made the decision today won't be held accountable then. Right. They never are.
Yeah. Yeah, that's really sad because I work with a lot of schools, and obviously that's definitely dug into my heart a lot with the schools closed. But a thought that I just had, do you think when President Trump came out and said, the states need to decide what they're going to do, and, kind of gave them the power, or didn't give them the power, just said, hey, it's your power to have, essentially. Now everybody's saying that, well, Trump's this big dictator and all these other things that are happening depending upon what media source you look at. Is this an exercise to get him to do that? In other words, if the governor shuts down the schools and President Trump wants the schools to open, and now he steps in and says, no, we need to get these schools open, does he become that dictator that they're claiming he is?
That's an interesting question, and it's a complicated question.
But it's a common question.
It's a common question, and I'm no attorney, and I'm not a constitutionalist, but certainly I've tried to learn. My understanding of the Constitution is if a power or authority isn't specifically and expressly given to the federal government, then it belongs to the states. Yeah. And I believe that that's what the federal government's trying to do right now, is saying, we don't have the authority to tell the states what to do. So in a sense, it wouldn't necessarily be the president who would be a dictator. It would be 50 governors are given the chance to be that emperor, if you will. Mm-hmm. But I think that politics being politics, sometimes there will be a movement that says, well, we don't like what our state's doing, so we'd like it to be overridden by some authority, and obviously North Dakota can't override Minnesota or vice versa, so you go to the federal government to get your way. And in that situation, my understanding is that the federal government is looking at ways such as funding mechanisms and things like that, trying not to overstep their bounds from a constitutional perspective, but yet necessarily potentially using tools that they have, such as funding. And where it all ends, I don't know. But I would feel better if we would let the citizens decide. And so if we reopen the schools, I think we can try to do it in such a way that parents' choices can be respected. Yeah. And we can do the physical distancing, and we can do a lot of good things. I don't think it has to be one size fits all, cookie cutter approach. And if teachers are nervous about going into the classroom, then we may have to look at that as a situation.
But then, so that doesn't make sense to me, probably a lot of people. Okay, wait, the masks work? The social distancing works? They're letting people out of prisons by the thousands? Teachers aren't comfortable in school if they have masks and social distance?
It's complicated.
Is it?
I think so. I think if you put a lot of people in a room, you'll find a lot of good people having extremely varied opinions, and not one of them woke up that morning trying to be stupid.
No, but 2 + 2 is still 4. Wait, is it?
I can understand why you'd ask.
So, yeah. I mean, a lot of it doesn't seem reasonable, and it doesn't seem logical. I can understand if they're uncomfortable. But wait, you said that masks work. So why are you uncomfortable? Hard questions.
Fear is not rational.
It's not.
And I think when we use words like logical and rational, we're sort of hoping or expecting that we're excising fear out of the equation. And I don't think we're able to do that. And I don't think we'll be able to do that until we get through this, look back at it, and say, what have we learned?
And I think that it's my feeling and my observation and my perspective. There are so many people in places of power that are really trying to use fear as a mechanism for the control.
I don't disagree with you a bit. I said that on April 7th when I was asked, why did I think that there might be a push to use COVID-19 as a cause of death when there had been no COVID-19 test done. And I think Chris Berg asked me, do you think they're trying to pad numbers? And I don't think I responded to that. And then I think he did a follow-up question about, well, why would people do that? And I think I did make a relatively provocative statement when I said, well, fear is a great way to control people, and sometimes it can paralyze our own ability to think. And that probably is a great segue into closing.
Yeah.
Because I think one of the reasons I was intrigued by doing a conversation with you, Matt, was just talking with you briefly. I thought, if we're trying to do anything in this conversation, it's trying to defuse the fear, trying to ratchet it down, trying to tell people, you know, if I can build your trust, I would really like that. But if I have to bully you into and force you to do it my way, that's not really who I am. So that's not what you're going to get through our conversation. And I appreciate having a conversation like this with me.
And I'll close with this. My daughter who died in the car crash was the oldest, so 3 younger siblings. One was already a driver, and the 2 others had to go through driving school and that whole thing. Now, yeah, I was scared to death. But I didn't, it was their decision. Did I give them the tools to not be afraid to drive? Of course. We went out, just like I did with the older 2, went out in the wintertime in the parking lots, and this is what happens when you lose control, so figure it out before it happens on the road. And all those things, we did all those same things to alleviate, to mitigate the fear. You know, we could have gone down the path of fear and said, you know, it's obvious. You could have, that path is very obvious. When you make the decision to not allow fear to control what you do and how you think, I think is extremely powerful, which is why I want to do that with the students. And I'm going to close with this. I do a teaching on shiny. You see my shirt? I am shiny. I want to thank you for being shiny. Thank you for being strong. Thank you for being hope. Thank you for being influential. Thank you for being necessary. Thank you for being you.
Thank you, Matt. I appreciate that.